I have always known I wanted to become a nurse.
I was very young.
I was still in college.
Nursing found me. I was a little confused about what I wanted to do as a youngster right out of high school.
When my uncle was diagnosed with a terminal cancer and I saw the nurses at his bedside every day giving him comfort and support.
From a little girl, my sister was very, very sick. And I just remember coming to the hospital. It was just a one-story hospital. The nurses used to take care of my sister, but the nurses took care of me and my mom too, you know, like if we needed something to eat, if we needed somewhere to lay our head, because they know we spent hours and hours here.
I was going to be an English teacher, and my dad suggested, what about nursing? You like to help people. So I started taking the classes and I just loved it. And I have loved it ever since.
People say, what do you want to be when you grow up? And I don't remember ever saying anything different than being a nurse.
My friend in college cut his hand really badly, so he went and had surgery, and they allowed me to come in and visit him while he was recovering. And I was so fascinated with the nurse and what she was doing that I almost didn't pay much attention to him. And I knew in that moment that I wanted to do what she was doing.
My grandmother was an oncology nurse and my mother was an emergency room nurse, and I would listen to the phone ring and knew it was a neighbor or someone in distress, and my grandmother and my mom would always just jump to help everybody. And I just remember thinking, wow, it's such an honor to be able to help somebody when they're kind of at their worst and they just need some support, and I wanted that.
This is a really good one. I might get teary. The moment I knew I wanted to become a nurse was when I was 8 years old. I was very, very sick, and I spent 6 months in the hospital. At one point they thought I had leukemia. I was transferred down to UC Davis at the Children's Hospital, and they ran more tests, and it was week after week that I was here. The way that I was treated, the way that my family was treated, we felt like we were the nurses' family. They take really good care of us, and I don't know, for me, I wanted to give that back. I wanted to pay that forward to other people's families.
In pre-nursing school, I thought, is nursing really for me? So I looked at volunteer programs, and UC Davis's was the first one I saw. And interacting with patients, it could have been providing them with water, providing them their meals, or playing board games. And the fact that I was just able to interact with the patients, I was building rapport and trust, it was when I started to realize, you know, I think I could do this.
I remember being in college, being very nervous, like, is this something that I want to do? Will I be good at this? I know the first time that I went to the hospital and I started taking care of patients in clinicals, it kind of like affirmed to me, like, this is like a calling for me. This is something that I'm passionate about. And I feel like my entire nursing career has just kind of reaffirmed that passion for nursing, and that this is what I actually want to do and what I feel like I'm meant to be doing.